Good morning, everyone. Welcome to another Leadership Greater Washington Frontline Conversation. This time we are with Tony Cancelosi, the President and CEO of the Columbia Lighthouse for the Blind. Tony, thank you very much for joining us today.
Thank you for having me.
So what happened when COVID hit? What happened? Well, first, before I do that, how are you? How are you personally? How are you taking care of yourself? How are things going?
We're doing very well. We've implemented here a safety officer to make sure that we're complying to all the guidelines because, we handle the whole region. So we've implemented guidelines for all of our employees to make them safe, and we're following that right now. So we're doing well, doing very well, and our employees are very, as you know, most of our employees are visually impaired and blind, and they're doing very well, and I can't be more proud of them because our doors are wide open to serve the visually impaired and blind, deafblind community.
So you're in your office now?
I'm in my office, yes.
And are most of the people reporting to work at the office, or are they working?
No, we have a program that we put in place through our safety officer and my head of HR, and we are gauging it by individuals and when they come in, when they can't come in. The buildings that we're in have all complied to, when I'm in my office, I don't have to wear a mask, but when I leave my office, I wear a mask. When you come into our office, our employees, they have to sign a sheet saying that they're okay. We take their temperature also. So we're following all the guidelines. So I've been pretty much coming in every day. Our building is secure here at 1825 K Street. They've done all the things that we would want. We have our offices cleaned, especially after we have people here. So we're complying to the district at Montgomery County, Prince George's County, all the guidelines. So we're doing well. Thank you.
So how's traffic around where you are now? We're a couple blocks away in our office because we're working from home. But
well, believe it or not,
more people come to work.
Picking up, yeah. I mean, the other night, leaving, there was cars backed up. More and more cars are visible. Ironically, around our building, all the parking spots are taken. So I don't know where all these people are, but they're here. They're here somewhere. They're hiding. I don't know.
One of our past guests on these conversations said that she could tell it was getting much more crowded when she couldn't just drive up and park in front of her building anymore, that all the spaces were taken and she had to find a drive somewhere.
Well, they're all taken here. You can't park here. So
what was it like? What was it like when COVID started and you had to, I assume you went to work from home right away, and how did that work?
Right, we did. What happened initially is that we had to make sure, because we're serving a population of people who are isolated and lonely, when you really start to think about it. And I guess I want to make a statement as I go into this, is that, and I want to set the tone, is how much do we value our independence, especially now, with all the things that are happening around us, with this horrible virus and a lot of the indifference that's going on in our world. How are we handling and accepting our own independence? Because at the Columbia Lighthouse, for 120 years, we just celebrated our 120th year. Independence is our vision. And that really hits home, especially now, when we're all questioning about our own independence and what do we do each day to keep our common sense about us and about how we handle our independence. So when all this hit, we knew that we had to bring our senior management team together, our board of directors, and make some major decisions. But we made one major decision, that we were not going to close our doors. So we built a program around our employees so that there would be the ability for them to still work, be on board. We would take care of them in the process, and they all stayed. And we just opened our doors and started to do everything virtually. And of course, we applied for our PPP money through PNC Bank, which was fantastic. We got our money right away. We brought all of our people back 100%. But more importantly, all of our clinicians and we had to close our clinic, we had to close down our van, but we went into an automatic way of how we could serve our people remotely. And we've set up all kinds of policies and procedures to do that. And in fact, Montgomery County, Prince George's County, the district, Fairfax County, all cooperated with us and continued to fund us so that we could serve the population that we serve.
Let's do a little bit of history lesson. You talked about 120 years for your organization. My guess is that, except for the Board of Trade, you're probably the oldest running organization in the region. So how did you all start?
It started in 1900 by a couple families who had children that were blind. And think about 1900 compared to today, right? And they were saying, well, we're having children with disability. What are we going to do when they grow up and we're gone? We need to start helping them figure a way to be independent. And that's the whole thing about independence is our vision, to be independent so that they will be able to live independently, earn a living, and be productive. That's how it started, with parents.
So contrast what it was like then with what it is today in terms of employees, outreach, and all that.
Well, if you follow the evolution of this, because when you thought of people who were blind, what did you think of? Caning chairs, right? And doing mailings and so forth. So as we've evolved, I've been here since 2005. We started programs to say, what more can a visually impaired and blind person? We're the only ones that also serve the deaf-blind community in this region. How do we make them productive so that they could earn a living and be independent? So we started to explore different kinds of technologies that we could use in order to enhance their skills. And through a program called the Ability One Commission, 30 years ago, they started to create job opportunities with the federal government. And so today, with a lot of the technologies that has evolved around people who are blind, and I'll talk a little more about that, how crucial that is, we started to get them into training programs. Like just this past 3 weeks ago, we do government contracts. We do top secret contracts with the federal government. We just signed the State Department contract. And when I got here in 2005, we got that contract. And all of a sudden, when we were signing the contract this past week, they realized it's a base plus 4 years, so 5 years, that they will be with us for 20 years. We've been serving the State Department with people that are doing certain things. I can't really tell you everything they're doing, but very efficiently, and it's a very nice contract worth several millions of dollars. So technology has brought us to the level of giving and creating job opportunities for people who are visually impaired and blind. And I can go down more of that road and whatever you want me to go, but right now we have just won the largest government contract that we've ever had, and I think it's going to be one of the largest in the digital data scanning for visually impaired or blind. We just won a $14.4 million contract with the Army National Guard, and right here in Washington, D.C. So we are hiring in the process now with RSA, Montgomery County, Prince George's County, recruiting 37 people to employ. And I'm here to tell you, we've already hired almost 20 of the blind individuals. We have to meet certain ratios. So think about employing 37 people in an environment that we're in right now where people are suffering because they don't have jobs. And so we've created this for the next 5 years. They're going to be earning double minimum wage. And we are very proud of our people that we've won this major contract.
So what were some of the difficulties that you had to overcome as you went to a virtual environment for your employees, for the people that you serve? I know you talk about digital accessibility quite a bit, but it must have been kind of jarring to go from a in-person environment to a Zoom environment.
Right. The biggest issue, and it's worldwide, it's something that we have to change, and we are changing it, is accessibility of websites, accessibility of technology, accessibility of what I would call reasonable accommodations that people get normally, where they can go online and get any kind of information they want about anything, your health, whatever. We are struggling to get the world to become accessible for people with disabilities. We have been working with Montgomery County, we've been working with the District of Columbia and Prince George's County and so forth to make all their websites accessible. Because you and I could easily get on a website and get anything we want in Montgomery County. But if their website in Montgomery County is not accessible, a visually impaired and blind person or deaf blind person cannot get that information. So the world has to change to make sure the websites and the accessibility of other technologies to be accessible. I'll give you an example. In Montgomery County, the council members that we've been talking to are making all their websites accessible. In the District of Columbia, we're doing the same thing. To give you an example, before all of this horrible virus hit, we had signed a contract with the National Restaurant Association of America, and we made their website accessible. We've made hundreds of restaurants, their websites accessible. So we're doing that for the federal government right now. We have a contract with Booz Allen and the VA for the next 5 years, which is worth more than $6 million to make all of the VA accessible for veterans that are visually impaired and blind. So opening those floodgates to get technology to be accessible for all people.
So we've got the anniversary of the Americans with Disabilities Act coming up. I think it's this Sunday.
Yeah.
What kind of impact did that have, and how does that benefit the people that you serve?
Well, the impact is that it's a law. I mean, it's something that people need to understand. I'm a commissioner here in Washington, D.C. on the Workforce Investment Board. And when you start to look at the Disability Rights Commission and the things that we do on the Workforce Investment Board, that all organizations that do training programs have to be accessible for all. You can't just distinguish one or another, it's all. So all websites need to have subtitles for the hearing impaired, and they have to be accessible for visually impaired and blind and deaf blind. So ADA has set some very significant guidelines. It's the same thing for the federal government. Federal government, all the agencies have to be 508, and they're not. Universities, 85% of the universities in the United States are not accessible for visually impaired and blind. So think about that. Think about you wanting to go to college and you're visually impaired and you can't access the university's websites to make an application. How do you feel? How does your parents feel about that? So ADA has set these guidelines, and we have to make sure that those guidelines are told to the individuals that need to do this. And ironically, universities are getting sued over it right now because they have to become accessible.
So you said 85% of the universities are not digitally accessible?
Yes.
Wow.
You can check that out.
No, that's remarkable. That's actually very
it's
sad after, would you say, 30 years of the Americans with Disabilities Act?
Right. Yeah. Well, think about companies like, I won't mention names, that have been sued enormously because their websites are not accessible. When you start to think about buying things online, Amazon's not accessible for visually impaired and blind. I shouldn't say, I'll take the name back. There are a lot of organizations that scratch that off the video, please. I don't want to get censured by whoever. But anyway, it's true. You will be shocked to know who is not accessible and how we are depriving. Do you know how many people are in the United States that are visually impaired and blind? Can you guess? I won't let you guess.
I can't.
Okay. Validated, Johns Hopkins, and many other institutions. 24 million people are visually impaired and blind in the United States. Wow. There's 329 million people in the United States. So 24 million of them right now are visually impaired and blind. And we did a study, and I'd be glad to share the study with anybody. We did our own census, and we broke it down even to the District of Columbia in this region, but on a national basis. But here's the statistic that I think most people do not know. Because of diabetes and diabetic retinopathy, and because of obesity and glaucoma, all these other diseases, especially diabetes, 1 in 3 people over the age of 65 could lose their sight through a macular degeneration. So think about 125 million baby boomers, and 1 in 3 over the age of 65 could lose their sight. So if we have any math geniuses out there, they'll see the number is enormous. There's no other disability that I know of that is not a death sentence when you lose your sight for you to survive the next 20 years of your life if you go blind.
So we have a question from our chair, Mahan Tavakoli, who's asking how is this crisis, COVID and the economy, how is that impacting the visually impaired community differently than the rest of the population?
Well, the whole thing is, it's affecting us because the accessibility is not there. It's affecting us doing more than we possibly can to reach them. If we had more accessibility, if I had accessibility to all the agencies in Montgomery County, and I don't mean to say Montgomery because you're the former county executive,
Okay.
but I worked with Ike Liggett. I was chairman of the Disabilities Commission, so I got to be very kind to everybody. But I am. We've got a lot of cooperation from everybody, and everybody recognizes the fact that without having that accessibility, we're affected by that. But we are very blessed right now that we're doing pretty much everything remotely. Like right now, we are teaching kids that are visually impaired and blind right now in our summer camp, and we're doing it all virtually. Fairfax County schools are going to be working with us. We're going to do it virtually because they're accessible. So it's affecting us that we can't touch or instruct people in person, but we've now figured out how we can be effective. In fact, this just happened. We're finding that we've been pushing this out. We just won a grant from the District of Columbia called DC Hopes. We are setting up a hotline for people to call into that needs our services. We're going to broadcast this throughout the whole region. We're going to have kits that we're going out to people who need them. We're going to do radio shows to let people know Columbia Lighthouse is here to serve that population. So has it affected us? Yes, but we're not stopping to serve the people the best we can, and we're getting good reaction. Like now we're getting calls from people from the Eastern Shore that we couldn't touch before. And most of the people have iPhones, and we're using Zoom and other technologies. The effect is that personal touch that we can't have our clinic open, and we can't use our van to go out into the communities because we serve children. We do eye exams. The effect, that's the part that is affecting us the most, is that we can't visually touch them in the sense of being there in person. But other than that, we're still getting all our funding from the federal government, getting our funding from the counties and so forth, who have been very generous to us. And we have to tell everybody out there that the state and local governments and even the state, we want a state contract, have been very generous supporting people with disabilities.
Have they talked to you at all about upcoming budget issues and perhaps some pullbacks at all?
No. In fact, in a couple of them, they've given us 6-month extensions, but what they're doing also is, instead of a 1-year, 2-year contract, they're expanding the contracts to 5 years. There are budget issues, but a lot of the money that's been coming in, which we've applied for, are federally funded. And I think the state and local governments, the ones I've talked to, the council members and the county executive, are all supporting us and putting money aside for us.
So you mentioned the summer youth camps, or the youth summer camps a little while ago. Talk to us about that. What are those like? How do they work? You're doing them virtually, you said?
We're doing it virtually. For 50 some years now, and I always try to get the right number because we've been 120 years, we've been doing summer camp for more than 50 some years. So we have what we call teachers for the visually impaired. We've been teaching in multiple numbers of charter schools in the District of Columbia and in Fairfax County and in Montgomery County. And so we've taken the curriculum that we have that we've been teaching in the schools, Braille and technology, we've incorporated that into programs that our teachers for the visually impaired have programmed together and delivering it. So we're having a virtual summer camp for the whole year. So the camp consists of 4 or 5 elements. The first one we did was we sent out laptop computers to all of the kids that are participating. And this is being funded by grants. And
how many children or how many youth are in the program?
This summer, this camp that we're doing right now is called Pre-EPS. This is for high school kids. We're taking on only 8 kids at a time, but we're going to do camp all year round. So there's 8 high school kids in this program. And so they all have laptops. We deliver to their homes supplies that they would have gotten at summer camp. And the thing that they're missing, one of the things they're missing is that we did day trips and took them, on day trips. But we had it at a Catholic university for 3 weeks. It was a resident program, which they lived on campus for 3 weeks. And so it was fantastic. I mean, we've had this for Catholic for the last 5 years. And so they lived in a college environment to give them, hey, this is encouraging you to go to college, right? And that's what we're teaching. So the first one we did, they all cooked a meal. One of the things is we teach them how to cook, we teach them how to be independent, but then more importantly, we give them the skills of what I would call interpersonal skills, because they need that confidence that because they're blind, they still have the ability to achieve high school and college. And so we also have a sponsorship program where you can sponsor one of our kids to work with you. Like Metro's hired somebody, Washingtonian, PNC Bank, all have one of the kids to be with them for a week virtually.
That's great. So one of the things we are, that we value very highly in Leadership Greater Washington are partnerships. You understand that you're not going to do something on your own. So Paul Rothenberg has sent in a sort of question about how are you using partnerships with medical organizations, other organizations to help do your work and help improve the region?
Sure. Yeah. Thank you, Paul. It was a great question. There are several partnerships that we've created that have given us, I think, the leverage to expand our services immensely. And one of them is with Providence Hospital, and it's called Providence Urgent Care now, but they're part of the Ascension Catholic hospital chain, which is one of the largest in the world. And we've teamed up with them both on this DC Hopes outreach, which I'll explain what they're doing. But with them, we have created the ability, we have a van that we acquired several years ago from K. Fritz Foundation and Care First. It goes out into the community. Providence Urgent Care and Ascension gave us a very significant grant to get another van. And this was all before the virus hit. And we had big grand openings and so forth. So we're going to be serving all the wards 4, 5, 6, 7, and 8, for our van to go out and do eye testing for children and adults, but work with Providence, which is an enormous opportunity for us because of their clinical services. And for DC Hopes, they're going to be the hotline for any clinical questions about the virus and about testing. And so that partner is working very, very well. The other, and of course, all Montgomery County, they're all partners that we work with. The other partnership is we are working with an organization in England, the Royal Academy of Blind Children, to set up an international workshops and an online system that we can develop for after-school programs. So we are bringing an international flavor to the Columbia Lighthouse, but it's for children, because worldwide children are essential to us. We work with parents who have a child that's born and called early intervention, and we work with that parent up to the age of 3 with that child. So the Royal Academy of Blind Children. Then the other partnership is with a group called Waymaps, which we had a project for the last 3.5 years to develop an app for people to travel on Metro. And we completed that project in 11 Metro stations, very successful. We have all the data. Now Metro is going to be developing it for buses, and we are going to be part of that. And so partnerships are very crucial. More importantly is other organizations like Berry Center and others. We work with them from our clinical services side.
So the partnership with the Royal Academy of Blind Children over in England, is that something that happened because of the COVID crisis? Is that So you're reaching further and further now because everything's online. Or is
Yes.
that something you've been working for a while?
Well, about a year and a half ago, they came to us to talk about what they were doing with this product called Waymaps. And so as part of that, we got into our technology about children. And they said, well, here's the Royal Academy. And ironically, they're funded by the lottery in England. They're well funded. And the other ironic part, I worked in England for 10 years. I ran a worldwide software company. And when I was there, we created the lottery in England. So I got an inside track. I know what it worked and how it works. So they were impressed by that because my title was Squire. You know, in England, you can't get Lord, you get Squire if you're American. So that's a joke, Doug.
But
so you can call me Squire. You can call me Squire from now on.
Do you know the winning numbers? That's the more important question.
I did. Well, the Queen picked the first ticket, and we were hoping that she didn't buy one. We were hoping that she didn't buy one and win. That would have been a disaster. So anyway, so that partnership is evolving because the person who runs the Academy and Waymaps is blind. He lost his sight when he was 30 years old. He has come to the realization that he lost his sight when he was 30. But what about children that are born blind or lose it when they're younger? What's going to happen to them? And so we're building this up and a lot of people think early education prior to first grade is very important. And we think it's the same thing with visually impaired and blind children. So we formed a task force with another one of our board members to look at this. We brought people in from Montgomery County to look at this. And we have a little task force with England, and we want to create standards with them. When I worked for ICL, International Computer Limited, our big thing in England was standards. So if we can create standards for the visually impaired and blind, that will open up this whole ADA thing and enhance the ADA thing.
So as you're planning with them, you're putting together programs with them, change because of COVID? Are you looking at doing things differently or doing new things that you wouldn't have?
Combination of both.
Had to be virtual?
Yeah, it's a combination of both because we're looking at creating an after-school program that schools we feel will adopt very quickly, and it'll be all virtual, it'll be all online training. Some of you might know that I was one of the individuals at Sylvan Learning in 1986. And when we started Sylvan Learning, our whole mission was getting students to be educated at the level to go through high school and go to college. And it was distant learning and we had training centers. So I'm replicating some of that in the sense that it's not going to be hard for us to develop online training for these individuals. It could be for anybody too. But once they get that after school program, they're going to get their social skills, they're going to get computers. And if you notice, there's a lot of after school programs in this region that are very, very successful. This will be the first one for visually impaired and blind children that will have that opportunity. And then it'll integrate into our high school program. So we're planning, hopefully, in October, November, 2 workshops that we're planning now with our people and our people in England. And, you know, the old Italian expression is, our people are going to do this, you know. So I've got the thinking that way. We're going to do this. And then after that, we're going to do a webinar. Dr. Pei and I are going to do a webinar and talk about how important this is for worldwide children who are blind.
That's tremendous. That's really, really interesting. Really fascinating. Can I ask you about the vans that you've mentioned before?
I couldn't hear you.
Work in terms of going out to do eye tests for children? Is it an appointment basis? Do you just show up at a place?
Well, the van itself is equipped just like going into an ophthalmologist's office. Dr. Bill Deegan is our chief medical director, doctor on our board of directors. He's our vice chairman. But more importantly is that we fill all the guidelines of equipment and technology and using board certified doctors. That van is equipped to go out into the community, and we work with children in the sense that we're doing eye exams for the school systems. And we're chartered to do that. We've got grants to do that, to go out and do that, not only for children, but also adults. But that van is the key to taking, right now, if you start to think about medical care, bringing medical care to facilities and to the community, we work with 3 different clinics right now that we do eye exams for them. These are people who don't have insurance maybe or can't afford to go to an eye doctor. That van has been served thousands and thousands of people for the last 7 years. So now we're going to have a second van with Providence to serve more. There's 60,000 people in this region that have been identified are visually impaired and blind.
So is the van being used now, or you've had to put that in storage until?
We can't use the van yet. We are complying to all the guidelines in the counties and in the states to when we can. And it's sitting there, but yet we are reaching out to the clinics that we can do some virtual clinic analysis.
Oh. And how's that working?
Working really well. I mean, we are overwhelmed by the fact that more people now are getting in touch with us virtually, and we can respond. So we've equipped our people with new technology, and we're constantly looking at how we're going to enhance. I mean, I'll give you a quick example. Orientation mobility is one of the biggest things that we offer to people that are visually impaired and blind, and help them get their white cane, okay? So we're set up where some of our, what we call orientation mobility people, are online with them and describing to them how to mobilize their apartment where they live. And even to the point of talking to them about how they can cook. We've had a program that ran for several weeks where we had our own condominium, and it was called Foundation of Adjustment to Blindness. For 3 or 4 weeks, you came to this condominium that we had, a condo, and we taught you how to cook, taught you how to clean, how to make your own bed, how to take a shower, how to put their makeup on, but more importantly, we trained you how to ride Metro. And that's how we created that app.
So you mentioned that you've got outreach now to the Eastern Shore. You talked about sort of a global outreach through your partnership with the English community.
Academy.
How has COVID changed your thoughts or your planning for the future for your organization? Here you've got this tremendous opportunity now to expand, to do a lot of different things because everyone's virtual now. Has that factored into your growth plans for the future?
It is. In fact, we're learning more about the fact that the curriculum that we can develop can be just as effective as if we were in person. And take the things that we're doing in Ocean City and Salisbury, in that area where people are calling in. If we can do 2 things, if we could take their loneliness and isolation and turn it into a positive, where they can say, I need to learn how to cook. Can you help me? Yes. How do I do that? We can send you some tools to your home. We're finding that we can do outreach and serve more people through the virtual side than having to travel from here to Ocean City. So we're putting that all into, that's why we're talking on an international basis, webinars, workshops, virtual shops, but the whole virtual aspect. And when we did this at Sylvan Learning, it was so effective. And it's amazing to me, from 1986 now, we're now in a situation where virtual and technology, that's why accessibility of websites and accessibility under the ADA guidelines is so crucial that happens.
We have another question from Paul Rothenberg about your federal government contracts and what kinds of work do the people that you hire for these contracts do?
Okay.
And please don't tell us any secret or top secret information. We don't want to do.
Well, Paul only has a secret clearance. I have a top secret clearance through the FBI. So, so I could tell you whatever I want. No, anyway, no. If you look at, I'll go right down the line. It was very clear in the years that I've been here and working with the National Industries for the Blind, who's one of our large partners, that we continually tested technology that was available for giving people visually impaired and blind skills. And as we adapted different kinds of skills and found the ones that work the best, the most efficient. Because remember, we have a government contract and we have to meet all the standards of performance. Because we're visually impaired and blind, and our 75% of our people on each contract is 75% blind, doesn't mean that we get away with it. We have to perform at the highest levels. So we zeroed in on 3 areas that we do things very well. One of them is digital data scanning. We have a stellar reputation to doing digital data scanning. We've done some major government agencies. So it's taking documents, scanning them, taking them apart, putting them together. And for the Army National Guard contract, we got to do 390,000 scans a month. Imagine that. It's enormous. The other government contract that we have, we do what we call contract closeouts, where the government will have contracts that are closing from different vendors and manufacturers and so forth, and they have to be closed out on an annual basis because there could be money left over on those contracts that they didn't completely use, and they're finding there's millions and millions of dollars. So we do contract closeouts. The very significant one too, besides those two, is 508 Compliancy. We're doing this for the VA worldwide with Booz Allen to provide accessibility, technology, and enhancement to all of the VA agencies around the world. That is very significant. We do it well, we get high marks. Those 3 areas are really the bread and butter for us. The other one is call centers, and that is huge for us. We do that. So giving people these skills and their upward mobility skills, and I can speak from the standpoint of being on the Workforce Investment Board, of all the people that have lost their jobs in Washington, D.C. and around the world, that these kinds of jobs are in existence. We're recruiting all the time, and there's a tremendous government opportunity for people who want to do business with the federal government.
So that leads right into the question from Elvis Oxley, who wants to know if you all team with small business contractors in order to apply for and get and obtain new contracts.
Yes, we have. We just finished, we went out for the first time. We won a contract out of our region at the Missile Defense Agency in Huntsville, Alabama. We're doing contract closeouts there. That is a win for us that amazes us that we won that contract, in the sense that we're coming out of state and we won it because of our performance. We've contracted with a small company called CM, Small Business Contract, DEA, that one. DEA contract. So contract small businesses, yes, we are.
So what lessons have you learned as you sort of wind down this conversation? What lessons have you learned in the past 4 months as you've gone through this? Any leadership lessons for us?
Well, I think for me was how our employees responded and did not abandon the ship and say, I'm going to go somewhere else. They all took charge. They all incorporated their intelligence. All of our people that work with the visually impaired and blind are board certified, our orientation mobility people. Then we have a staff of people who all said, hey, this is what I can do, how I can do it. The lesson I learned is how our people are so dedicated supporting those who are visually impaired and blind, and the deaf-blind community. Because serving the deaf-blind community, there's more than 900 people in this region that are deaf-blind. And we have people that have stepped up to the plate and said, I will go visit them, because that's what we have to do that. And Montgomery County stepped up to that, gave us a grant to continue to do that. So lesson learned is that people who work for organizations who become loyal and who believe in what they do, and that they are helping others because they can't help themselves, that's the lesson learned.
Well, my next question usually is, give us some good news. And you just gave us some great news, but any other good news you might want to share with us?
Well, I want to share that the idea of being part of leadership of Greater Washington and having this opportunity, because people really don't look at blindness as something that they take seriously in the sense of losing their sight. And I hope and pray that people recognize the 24 million people. I didn't break that down for you, but I can break it down very quickly. Out of the 24 million people that are visually impaired and blind, and we broke it down by every category. And it breaks down where women have the highest rates of blindness of anyone else. And you look at different populations of people from the working ages of 18 and above, and people that are over the age of 65. This is a category that's going to expand enormously. So we need everybody's support to recognize, and I can guarantee you that we all know someone who is visually impaired or blind. We need to take accessibility as a goal that we all achieve under ADA, but more importantly is we all need to pray for our country and pray for people who are being left behind. And every conversation I have, I hear all the other people are being left behind, and I never hear about people with disabilities. So I'm hoping this opportunity for you all to recognize people with disabilities.
So Dahlia Shaywitz has a question about how do you support the deafblind community during the COVID crisis when you really can't interact with others? You gotta stay separate.
Well, we are going to interact with them because we have several we have another partnership that we're creating that serves the deaf-blind community, serves the deaf community, and several of their certified members said that they would be willing to do that for us. So we are working on getting the deaf-blind community served by these individuals who are board certified also.
Wow, that's tremendous. So Tony, any LGW members that you've reached out to or have reached out to you over the past few months
all the time.
to help you?
Well, you know, Corey Griffin, Lisa Mowry, Ricardo Brown just celebrated his birthday. So we're all, you know, 007. We forgot to say 007. I guess it's all over the place. But more importantly, we're still
licensed to lead, right? Licensed to lead.
Yes, yeah. I have my 007 Mustang, by the way. But I do. I mean, it's been such a great opportunity to be part of leadership of Greater Washington. It's not necessary for me to say that, but it's true. And we continue the charge that I think is essential by doing something like we're doing today. And it's so important that all the members of leadership of Greater Washington should take that lead. And thank you, Doug, and thank you, all of your staff.
So what are ways we can help you? I think one that jumps out to me is the digital accessibility and having you all, you can be hired to check people's websites and make them digitally accessible. Is that correct?
Right. Yeah, and guess what? You're accessible. We did your website.
I know.
I forgot to say, I didn't want to brag. I mean, I figured you guys would brag about it, but you're accessible. You're part of the family.
But that's one example of reaching out to you and having you make sure the websites are digitally accessible. Any other ways that we could help you as you go through?
I think recognizing the fact that we have a population of people who need us. And once they know that we're there, their independence grows. They build the confidence. And that's why the program with the Royal Academy of Blind Children is giving the younger children the social skills they need to blend in with everyone else and not look any different. We don't want to look different.
Thank you so much for this conversation. It's really been enlightening. We've learned a lot. There are now ways we can get involved with you. I'm just going to turn it to you for the final word for today.
The final thing would be is that we're going to have a virtual celebration of our 120th year, and it's going to be virtual. And our guest speaker, and one of our partners is my eye doctor, Sue Downs, who's the CEO, who is fabulous. Keith Mendelson, who represents a very large law firm. He's retired now, I can tell you that. But we've got people like Andy from Busboys and Poets, who's our chairman of one of our committees. And Andy's been fantastic in helping us. Tom Raffa is another one. Again, Providence is Dr. Tam and so forth. So this virtual, we're going to be honoring one of our board members, but also a person who's been so significant to the Columbia Lighthouse, a person named Sean Calloway, who lost his sight many, many years ago, went on, finished his college education, got a master's degree from Catholic University. He works for HHS, but also he does some consulting for us, a circle of friends that we have. So our virtual thing is open. We're going to have special categories of people. We're going to introduce the 120th anniversary coin that we're designing. So that I hope we're going to have, anybody can log on. If you want to make a donation, you can. But if you want to get a coin, there's a category. Our other partners, Bernstein Investments, they've been gracious with us. I don't want to forget anybody. This is an advertisement, right? You know. Oh, Leadership of Greater Washington, you know. So.
Tony, thank you for mentioning Andy Shalal. We just had him on the last Frontline Conversation and talked about the struggles of the restaurant industry and the unrest that we've seen across the world.
I just talked to him in
conversation.
Yeah, he's a great guy.
I do want to point out for the record that Sue Downs is not your personal eye doctor, but my eye doctor is a company that she is the head of. So
yeah, she's the CEO. Yeah.
So you said my eye doctor, Sue Downs, is coming. Okay. Well.
They have 500 locations.
Tony, thank you so much. Great talking with you, and I hope to see you soon. Thank you.
All right, thank you.